Hello everyone. Do you know how communication works between nurse and patient? To know more about this, let's move on to the video. Communication and nurse-patient relationship. Introduction. When two people interact and they try to exchange information with help of language or gestures is known as communication. Definition. Communication is defined as a process of generating, exchanging, understanding and transmitting the information between two individuals. Elements and process of communication. It is a process of exchanging verbal and non-verbal messages. It is a continuous process. This message must be conveyed through some medium to the recipient. It is essential that this message must be understood by the recipient in the same terms as intended by the sender. He or she must respond within a time frame. This communication is a two-way process and is incomplete without a feedback from the recipient to the sender on how well the message is understood by him or her. Sender is the one who does the initiation of the communication. It means the person who is starting the information or thinking of sharing the information. Message is the information which the sender wishes to send with another person. It is the thought that there has to be conveyed to the other person known as message. It includes the idea. Idea means the information that the sender wants to share. Encoding. It is using media to put the information in an understandable manner, like using the words or language. Channel of communication. It is a method how the sender will deliver the message to another person. It can be telephonic conversation, it can be face-to-face information given, or it can be written message. All of these are channels of communication. Channel can be auditory, spoken words and cues, visual, sight, observation and perception, touch, kinesthetic. Nurses use all three channels to communicate. Interference. It is any kind of disturbance created in this environment. It can be a device that can distract the receiver or which can distort the message. For example, if there is disturbance in telephone wire, then the message will not be received by the receiver in the manner the sender wished or encoded. In other words, anything that intrudes or disturbs in delivery of message appropriately. Receiver. Receiver is the one who receives the message to whom the sender intended to transfer the information. Feedback. Feedback is the written behavior or response of the receiver, which means the message is understood by the receiver. Feedback involves decoding. It means the translating and interpretation of the message that was sent to the receiver. Intrapersonal communication. It is also known as self-talk, like we decide what to wear. Similarly, nurses also do intrapersonal communication through which they enhance and focus towards positive interaction. Interpersonal communication. It includes the communication between two or more individuals and always have goal to exchange messages. Interpersonal communication further can be group communication, public communication, mass communication, organizational communication. Types and modes of communication. Verbal communication. It is the traditional way of communicating and language is the channel of communication. Language can be used in the form of oral or written form. Verbal communication is dependent on the language so that it is understood effectively. Types of verbal communication. Oral communication refers to the communication that involves the use of spoken words and done by word of mouth. It involves face-to-face conversation or speech. Therefore, the pitch, volume, speed and clarity of speaking affects the feeding of communication. Written communication refers to the communication which involves use of words through letter or memo or report, etc. It is commonly used in organization. Nonverbal communication. It is a type of communication that involves wordless conversation, also referred as body language. This type of communication helps nurse to understand hidden meanings what patient is not expressing or unable to express. Factors influencing communication. Attitude of nurse. Attitude sets the mode of nurse-client relationship. Like when working with positive attitude, the nurse will approach the patient in unhurried manner, avoiding abrupt responses, making patient feel valued and respected. Cultural background. Nurse should be aware about the different socio-cultural beliefs and practices. Gender. Men and women communicate differently and their perception and interpretation of information may also differ. Status or role. Patient's role in society or occupation can affect the nurse-patient relations. Environment. Suitable area or environment helps. Collecting patient history in waiting area can cause patient to be uncomfortable because it is a public space. Physical, mental and emotional state should be assessed. If found suitable, then only communication can be effective. Values. Personal values of nurse and patient may differ and may lead to disruption in communication. Developmental stage. According to the age, the understanding and perception changes. With this, intellectual and psychological development occurs. So, communication shall be as per age. So yes, we have reached the end of this video. In this topic, we went through communication and its elements, types and modes of communication, and finally, the factors influencing communication. If you have any doubts, please comment it down. For more nursing related notes, download the Nursing Guru app on the Google Play Store. Thank you for watching. Bye.